That phenomenon of people reaching their breaking point
She's been freaking out for the last 20 minutes.
seems to happen just as much in veterinary medicine. Hello, welcome in guys. I'm Dr. Jim Cellini. I'm a board certified practicing veterinary neurologist. On today's episode, I want to talk to you about an article that was recently published in The Atlantic entitled The Great Veterinary Shortage. If you didn't know, the veterinary industry is facing a crisis as it relates to an increasing demand and perhaps a lower supply, relatively speaking, than has ever been. So I wanted to talk to you about this article and some of the issues therein. If you don't mind hitting the like and subscribe button, I would greatly appreciate it before I get started. And yeah, let's talk about the article and the issues at hand. The article starts off with a quick story about a cat named Stokes. Stokes and his parents are moving to Cleveland, Ohio. And Stokes, they don't mention why in the article, but Stokes has a necrotic wound that the owners really need to get treated because a necrotic wound is bad, in case you didn't know. And they talk about how the owners had to call like 50 different vet hospitals before they could get in to see somebody a week later. Unfortunately, Stokes is okay, but it took that much effort just to have their pet seen. So this leads me to the first thing I want to talk about, which is the fact that this sort of thing is becoming much more common these days. Up until like January, February 2020, this was unheard of. If you were working in a vet hospital and somebody called about their cat in a situation and you told them that we're too busy, A, you really never were that busy except for like rare circumstances, and B, you really couldn't just tell people that you couldn't see them. That would definitely lead to a conversation with management.
Yeah, I'm gonna have to go ahead and sort of disagree with you there.
The first thing I want to let you know is just that this is kind of the new norm, unfortunately, and I don't know when it's going to change. Now, the article goes on to talk about how veterinary medicine has had a staffing issue for years, and that's true. Every place I've ever worked at has had some kind of like mild to moderate issue with staffing, either with vets, vet techs, receptionists, everywhere up and down. That's just kind of how it is. But lately, since the COVID-19 pandemic, things seem to have shifted just a little bit to where the system really can't handle it. And it seems like all that was really needed was like a little bit of push or stress on the system, and then boom, that was it.
All it takes is a little push.
The article talks about how once the COVID-19 pandemic hit, demand for veterinary medicine went up. Now, most people think that this is because pet adoptions spiked and shelters were emptied out and more people owned more animals. But the AVMA recently released some data in late 2021 that shows this isn't actually the case. In 2020, the year of the pandemic starting, pet adoptions actually decreased compared to previous years, as you see in the graph right here. People actually weren't adopting more and more pets. So if that wasn't happening, or at least the data doesn't support that, what was the reason for the increase in demand? Well, in the same report released by the AVMA, the demand actually came from current pet owners wanting more care for their pet. And as the article mentions, owners were staying at home 24/7 with lockdown orders in place, seemingly staring at their animal all day, thus seeing things leading them to be worried more, thus requesting more and more veterinary care. Now that kind of speaks from the demand side of things. The demand for veterinary care has gone up. But speaking on the supply side of things, there's a few things going on that seem to be kind of the more important aspect of this crisis. The article mentions how older vets nearing retirement decided to just retire a couple years early, or earlier than they would have once the pandemic hit, because it's honestly just too much stress and not worth it when you're that close to retiring. So a good chunk of veterinarians left the workforce. In addition, the article also mentions how the veterinary field skews quite female. Veterinarians who are mothers decided to stay at home and work less. So to summarize, we have removed veterinarians from the workforce, either by stay-at-home orders, early retirement, having to care for their families. We've increased the demand of vet care. Each of these individual changes may not be that much, but they're all happening at the same time, and that has essentially performed a stress test on the field that the system can't handle. The article brought up in the next paragraph the fact that pet owners are pretty much at their wits' end. You've all seen videos online of like people freaking out at airports and on airplanes.
Take your hands off me! I am 23 years old.
That phenomenon of people reaching their breaking point seems to happen just as much in veterinary medicine. And they talked about in the article how receptionists in vet hospitals seem to be experiencing a huge turnover. They interview one practice owner named Gary Block, who I may or may not work for, who says that he has lost about 80% of his receptionists in the last year. I've seen the receptionists where I work get verbally abused, sometimes threatened, oftentimes threatened. And it's just simply not worth it for somebody to work in that sort of an environment. So you got to realize about veterinary medicine, a lot of it actually starts with the receptionist, because the receptionists are the ones that are like collecting deposits, taking phone calls to schedule appointments. Sometimes people don't know if their animal should see a surgeon or a neurologist or an internist. And the first line in that process is a receptionist. So there's a huge role that receptionists play in veterinary medicine. And you need them to be experienced in order to kind of keep the workflow going as efficiently as it needs to provide everybody the best care you can. So shout out receptionists. One of the more important paragraphs in this article is when they talked about veterinarian burnout as it relates to veterinarian suicide. They interview a veterinarian and bioethicist named Dr. Lisa Moses. She attributes the burnout to quote unquote constant and cumulative impact of moral distress in the job. They talked about how people like me who decide to become vets, vet techs, and support staff tend to do so because they love animals. We want to help animals. But unfortunately, this veterinarian job also comes with watching a lot of animals suffer like on a daily basis. I can't tell you how many times people have said, I don't know how you do your job. They bring up a really good conundrum here, which is the fact that some owners have to let their pets die because they can't afford care, while other owners do the opposite. They refuse euthanasia and they instead subject animals to futile medical treatments or just let them continue with a poor quality of life, and they don't let you do what you think is in the best interest of the animal. They discuss how in a survey from a few years ago, the majority of vets said that they sometimes or often encountered cases in which they could not do the right thing. More than 75% said these cases have caused them moderate to severe distress. In understaffed hospitals and clinics, overworked vets are finding that they cannot provide their desired level of care and attention to each animal. That's definitely true. I've seen this now for 2.5 years. This is without a doubt happened. And how it's kind of self-enforcing. The fewer people and staff there are, everyone gets more overworked. And the more stressed out and overworked they are, the more likely they are to quit. Again, this is a self-fulfilling prophecy. Equally important to the veterinarian burnout issue is the fact that amidst this staffing crisis, as they describe, animals are sometimes getting worse care than they should. They talked about a dog who had a torn Achilles tendon who wasn't able to get it fixed for longer than it typically would have taken. And they mentioned how emergency hospitals have to turn patients away and to try to contact nearby vet hospitals to play this game of musical chairs to see if they can send a patient somewhere. And the end result of this situation is just that the animals are suffering more than they should sometimes. Now, I can tell you, everywhere I've worked, myself included, every doctor I've ever worked around, every vet tech, we really try to do everything we possibly can, but our capacity to help animals is finite. And that limit has been reached the last 2.5 years. And it's really unfortunate, but it's gotten to be where you just cannot help animals as much as you want to and as much as you previously could have. So the article wraps up talking about how the vets and vet techs that the author interviewed, they don't really see things getting better in the short term. They talked about pay going up, but not as much as inflation is going up. Everybody knows about that now. They mentioned how corporate vet practices have started offering bonuses as high as $100,000 to vets who sign 3-year contracts. I've actually seen higher than that advertised recently, believe it or not, which is insanity. They end the article by stating, by the year 2030, the US will need about 41,000 additional veterinarians and nearly 133,000 credentialed vet techs, according to a recent Mars Vet Health report. So I don't see where all these people are going to be coming from. People ask me a lot of the times, what are my solutions to this problem? One thing that I can think of, aside from compensating support staff better, I think that's a big one, but at the end of the day, you can't just like throw money at people and expect them to be abused all the time. You have to change like the nature of the job. So that's part of it, but not all of it. One big solution that I think would help the most would be to get some sort of like mid-level practitioner system going. In human medicine, they have physician assistants. I happen to know one, my sister-in-law, Andriana, shout out Andriana. But physician assistants fill this role of helping with the medical cases that don't necessarily need the entirety of a doctor's attention and resources towards. And there's a lot of patients out there in the world who benefit just fine from physician assistant care. Think about like when you go to urgent care, you don't necessarily always need a boarded medical doctor to provide you care. You can have a physician assistant do the same thing. That doesn't exist in human medicine. And I think that if we started opening up careers and opportunities for people to get the equivalent of a veterinary PA, that might help the problem, because that might reduce the workload and caseload for doctors and vet techs. So I think that's probably the one thing I can think of that would help the most. The other major change that I would institute to help with this problem is to stop getting Panera for every single interview dinner. No. All right, guys, so I hope you enjoyed the summary of the article. I enjoyed reading it. It was shared by a lot of veterinarians on social media, so I wanted you to be aware of it too. Let me know in the comments below what you think of the article and the situation at large in veterinary medicine. Happy to talk about it. Thanks for watching, and I'll see you next time. Have a great day.